tēnā koutou, tēnā koutou, tēnā koutou katoa. Good morning, everyone. Kia ora too, and thank you very much for your words and your blessing for this third learning session. Inspirational. Well, you know, actually you are the inspiration. Just being here at this beginning of this learning session gives me inspiration, and just hearing some of you speak to me informally about some of the things that you're doing in your own areas has been inspirational. I've seen pictures of your last learning session. I think there was a photograph taken of you all together and it was put on the website. And there is a sense when people have spoken to me, both commission staff and people that I've met, that there's been a wonderful sense of energy, excitement, but of course challenge, hard work. I've heard about the support that you've given each other, not just at a national level, but at regional levels and at local levels, and the teamwork that has started to develop over the past year, and the trust is really important. You're starting to get to know each other and know each other's strengths and talents and skills, and know who you can talk to help you with the work that you're doing. So that's about teamwork. We've just recently seen a most wonderful example of teamwork in the All Blacks, and I'm going to talk about them before everyone gets bored with people talking about the All Blacks, because that'll happen quite soon. People will be talking about them as an example of teamwork and leadership. But they talk about being one team. And they just don't mean the players, they mean all the support people, not just the coaches and the players, but the whole infrastructure that they build around them in order to be the team that they need to be and to succeed as they did in England. So the one team idea. They're all aligned to the same focus, very focused on winning that cup. But it's very clear that they do it within a platform of quite strong values, of being able to demonstrate their values and how they work together, how they trust each other, how they want to project their image, how they want to be seen, how they want to let everyone know that they care about people in general. You can see a sense of delegated responsibility. So the coach isn't just the coach, he has a whole lot of other coaches, and responsibility gets delegated. Even in the media stuff, it isn't the captain that just talks, the responsibility gets delegated across the whole team. And you might have heard Dan Carter talk about innovation. He said everyone is able to talk about doing new things, of innovating, of trying things out. They're allowed to try out new ideas, new techniques, and if they work, they then become part of their brand and part of their whole teamwork. So the innovation builds on itself and then it becomes standard practice. So isn't that actually what we're trying to do? We're trying to do innovation. We're trying to look at new things, bring new ideas to improve patient care, to improve what matters to patients, to include them in how we think about the care that we give, and tackling a particularly horny and complex problem like medication, or high-risk medication like opioids in doing this, and learning techniques through this one window of opioids. So what I think you have been experiencing all year in your local teams, in your regional teams, and in this national collective, this national collaborative, this national network, is a variety of teamwork and building teamworks. Now, you may have heard me or other people talk about the essence of quality being a triangle, a bit like the triple aim triangle, but a triangle on its own, where clinical leadership capability is one part of the triangle, the other is consumer partnership or engagement, and the third part is measurement and information. And it's those three things all working together simultaneously that brings about a whole culture and a value of quality and quality improvement. So you are the leaders. You may not all feel like you're leaders at the moment, and you may think some people are more leaderful than others, but part of this experience is about you becoming a leader. Leadership is about a verb. It's a doing things. It's about you bringing your skill, your knowledge, your new learned capabilities into your practice in a leaderful way, and not just about what you've been learning about reducing harm from opioids, but bringing that to all of your work and all of your practice in the teams that you belong to and the services that you work in. The second is measurement, which of course you look around all of the posters and it's all about how you measure what you're doing, how you think about how you need to improve, and the kind of skills and techniques that you need to learn, the science behind it all, so that you can see if you're making a difference with your intervention. And these are called, of course, small tests of change or PDS cycles, and you can do them quite rapidly, but they all build up to a bigger change environment, a bigger culture change in itself. And thirdly, and probably most importantly, is the consumer partnership and engagement, and Chris is going to be talking much more about that, and I know that you've been involving consumers in this all the way, so what matters to the patient, to the person, is always at the centre. So you're going to have a wonderful 2 days here. Whoever chose this venue has also been truly inspirational. I mean, look at this wonderful view that you have to look at all of the time in this beautiful spring day in Auckland City. It couldn't be better, it couldn't be more perfect. So we have this inspirational climate as well to aid all of the discussions. Opioids are so important as a drug. We wouldn't be doing the kind of modern medicine that we have today. None of us would be wanting to attend a surgeon or having anything without an opioid. But we also know that they cause harm, and not just in side effects, but of course is quite a big abuse industry. So it's a really important subject in and of itself. And I know that you're going to come up with new, innovative ideas. There's nothing in the world that is like the collaborative that you've been running to think about new ways of dealing with the harm that opioids cause. So we're all looking forward to the variety of new and bright and creative ideas that can be taken in, not just with this drug, but the skills that you've learnt that you can take back, and the networks and relationships that you've made that will last a long time and that you will continue to use in the work that you do for the health sector. So have a great 2 days. And I'm sure I'm going to stay this morning. I can't stay, unfortunately, for the whole time, but I know I'll hear all about it. Kia ora.